I'm Dr. Julia Giyaur, and today I'd like to talk to you about a common condition that affects a lot of us, and that's cataract. I'll answer some of the more common questions that people come up with. So all of us, with time, will get cataracts. What is a cataract? Basically, we're born with a clear lens inside our eyes, and that lens is what helps us focus. So the lens, when we're born, looks something like this. It's completely clear, and we can see through it. It helps us focus and see everything. As we age, that clear lens becomes opaque, becomes not clear, and sometimes even yellowish. So when we try to look through this kind of lens, it's actually not clear. So the first things that you may see are blurred colors, and with time we see all kinds of glare from the oncoming traffic, and then with time we really gradually lose the ability to either read or see far well. So when cataracts develop, people usually come and see their ophthalmologist or optometrist, and they're usually told you have cataract and you need cataract surgery. What is cataract surgery? Basically, the gist of cataract surgery is when we remove the cataract, the opacified lens from the eye, and put in a fresh new implant. So something that mimics our natural lens and helps us see. So that's the gist of cataract surgery. Cataract surgery takes place typically in the ambulatory surgical center. It's a same-day surgery, which means that you get there, you spend a few hours there, and you go home. Cataract surgery itself takes about 10-15 minutes to complete, is virtually painless, and is done under mild sedation, basically. So most people do not sleep during cataract surgery, although you do get a little bit of mild sedation and you might be a little bit drowsy, and some people do take a nap. But since the surgery takes only 10-15 minutes to complete, most people don't really have a chance to get that deep sleep that you associate with anesthesia. So we're fortunate enough to live in the times of amazing technology that's made for cataract surgery. Because of all these advances, cataract surgery recovery is amazing. I mean, I have people telling me that same night they're seeing so much better and so much clearer than they do before. We do want you to use some drops for a few weeks after cataract surgery, and occasionally vision takes, a few days to really get that perfect clear vision that you'll have, but it's a painless recovery, it's fairly straightforward, and most overwhelming majority of patients do great. So cataract surgery is a one-time deal. You will remove it, we replace it with a lens, and you're done. It does not grow back. Occasionally, the implant that you always get during cataract surgery gets a little bit opacified. It gets kind of a film over. It's a very quick, straightforward laser that we do in the office sometime after it, from 2 months to maybe sometimes even 10-20 years after cataract surgery, to clean up that lens implant to have you see great again. But cataracts do not grow back. So most people are able to return to their usual daily activities within a couple of days after surgery. I have some patients who even return the day after, but it really depends on what your job is. If you have to lift heavy weights as part of your job, then maybe take a few days off. If you're responsible for driving, like commercial drivers, for example, take a few days off to just make sure you're comfortable driving. But otherwise, cataract surgery does not carry very long and heavy recovery with it. So it's very important to pick the right eye surgeon, the right ophthalmologist for it. You want someone who has years of experience And you want someone who can offer you the best of technology. There's so many advances out there now. You want someone who has experience with all those advances and will offer you the right things for you. So decision to have cataract surgery and decision to select options that we do have available right now during cataract surgery, it's a very individual decision. You want someone who will sit down with you, have that consultation, spend the time with you to go through options, spend the time with you to find out what your lifestyle is, find out what are the best choices for you specifically, what are your goals, what do you want to do in life. Once that surgeon sat down with you and had a conversation and discussed all the options with you, you want someone who has experience and who's used all these lens implants and who's used lasers for cataract surgery to be able to deliver perfect surgery for you. So as I mentioned before, we live in a very exciting time for ophthalmology. There's so many technological advances that make my job easier and more challenging at the same time. So when we choose the lens implant, there's many choices that we have. So it used to be where we had just one implant for a patient and that was it. And typically people would need to wear glasses afterwards. Right now we have many choices for lens implants that allow patients to remain glasses free or to become glasses free after their cataract surgery. So there are options for lenses that are called multifocal or premium lens options that basically can do many things. They can treat your astigmatism, they can fix your distance vision and fix your near vision. There's also a very exciting option right now specifically for the implants that we use during cataract surgery, and that is something that's called light adjustable lens implant, so in short, LAL. And I'm very excited by that technology. It became approved in US a few years back, and we're all very excited to offer it to our patients. The thing with light adjustable lens implant is that they allow us to adjust your vision after the implant has been inserted and to give you the best possible, the most customized vision specifically for your needs. So that's a very exciting technology that we now offer. Another option that we have now for our patients is to do something called laser-assisted cataract surgery, and that is something that traditionally, we've done cataract surgery using ultrasound energy, which is a bit less precise and has been used for probably around 70 years in cataract surgery. As of past few years, maybe about 10 years, laser cataract surgery has been approved in United States. And as you know, laser energy is very precise and does exactly what we need it to do to achieve the best possible results for your vision. A lot of what we do in cataract surgery is covered by insurance. Regular cataract surgery, anesthesia, your surgeon's fee, and a simple lens implant, what's called a monofocal lens implant, all of that is covered by insurance. However, there are some options that we offer to some of our patients who are eligible, and those are multifocal lens implants, light adjustable lens implants, and other premium lens implants, as well as laser cataract surgery. So these options, unfortunately, at this point in time, are not covered by your medical insurance. If you have any questions, so you've been diagnosed with cataract and are not sure how to proceed, please give us a call, come in for a consultation. We will sit down with you, go through your options, evaluate your eye to make sure that you can get the best possible vision after your cataract surgery. Give us a call, schedule your cataract consultation. We have offices in Manhattan and in Brooklyn, and we'll be happy to see you.